October 2006, a number of individuals from two groups, PIPS and RAISE, embarked on a development programme with the PPR project. PIPS and RAISE provide support for those affected by suicide and self-harm in North Belfast. Both were set up as responses to a critical rise in suicide and self-harm in local communities. Members of the group had already been involved in the successful campaign to get a suicide prevention strategy for Northern Ireland, Protect Life. They were also fully aware that getting the policy was only the start of a long, slow process of making change happen. Their main aim was to find out how human rights could be used in their struggle to improve the mental health services that were available to them. This is the story so far of the PIPS RAISE Rights Group.
We hope today will be useful and relevant to the groups who have struggled to make these issues visible, and will enable them to move forward not on the basis of their need but on the basis of their right. And that's the purpose that we are all here, it's the purpose the panel is here, and it's the purpose of this project.
And so it's very exciting to be here and to see how international law is being put into practice on the ground by real people.
Over the last number of years, government has responded to increasing community concern regarding mental health services through policies such as promoting mental health and Protect Life. In addition, a number of committees, including the Assembly Health Committee, the Suicide Strategy Implementation Body, the Bamford Review and the McCartan Project Board are also working on these issues.
Further, despite a bid for mental health monies totalling over 84 million, the draft budget has allocated a total of only 29 million over the next 3 years, which is a rise in current funding of less than 1%. In stark comparison, from 2000 to 2006, the British government have invested an average 6.6% per annum rise in mental health spending, with 11.8% of the NHS budget allocated to mental health. In Northern Ireland, despite the higher prevalence of mental health issues, only 8.4% of the budget is allocated to mental health. While it is clear that there is a level of commitment to improving services, policy and legislation for those with mental health issues in Northern Ireland, mental health policies are lacking in effective monitoring systems, and many are missing vital opportunities for participation within communities, and the implementation of many policies fall at the resourcing hurdle.
Despite a wave of publicity announcing extra cash for the final health budget, in real terms the rise is equal to 0.1%. The extra monies allocated to mental health still falls far short of what is required. During the course of the PPR development programme, the group made a long list of all the issues they had faced with mental health and other services. They then narrowed this list down to 4 issues by identifying which issues were best covered by international human rights law.
There was no letter at all, and only for myself and Carol phoning and putting pressure. Tony wouldn't have been in the system at all.
The first thing that we identified was getting a follow-up appointment when you're discharged from hospital. We felt that this was something that we could possibly get quick and effective change on, and that it wouldn't require many resources.
The Mater Hospital issued guidance on follow-up procedures in its discharge protocol of February 2007. It states that, while the timing of follow-up is an issue to be decided by local clinicians, they should be aware of national guidance. National guidance states that all discharged patients who have severe mental illness or a recent history of deliberate self-harm should be followed up within a week. The group survey revealed that only 13% of those discharged from hospital after mental health treatment had received a follow-up appointment within a week. The group then set indicators of what change they would like to see and a timetable for that change to happen. In 6 months, the group wants the number of people receiving follow-up within a week to increase to 45%. Within a year, the group would like to see a system in place ensuring that 90% receive their follow-up within a week.
But there's simple things, like when people are discharged from hospital and are a psychiatric unit, why do they not give them an appointment card? Why wait on a letter? a letter that doesn't arrive. In our case, a letter never arrived. You know, why not give somebody a wee card to turn around and say, you will be seen at this time, on this date, on this day. And because that's a lifeline. It's a lifeline to the patient, it's a lifeline to the carers, knowing that they're not going to be lost in the system, knowing they've got a target, knowing that they're somewhere going to be there.
This is a small issue, but one that would make a huge difference to families and at a local level on the ground if it was addressed. And as a result, the group, as you can imagine, is keen to see it happen quickly.
In the human rights perspective, it's very important to underscore the voice of users of services as monitoring services, and the notion that indicators and benchmarks are a way of assessing the progressive realization of rights.
What is different about this project is actually creating indicators and benchmarks and monitoring those with respect to specific problems.
Participation is the most important indicator that you've identified, but I think it's the most challenging if it's going to be done properly in a meaningful way.
The right of individuals and groups to participate in decisions which affect their lives is a key part of the right to health. The group's baseline survey found that 79% of mental health service users rated their level of involvement as low, between 1 and 3 on a scale of 1 to 10. In 6 months, the group wants this figure reduced to 65%, and in a year to 50%. This would provide the group with evidence that government is progressively realising their right to participate.
And them now involved us more, you know, and they've seen our point and how left out we had felt, and we feel a bit comfortable, we feel a wee bit better. You know, we think our recommendations, and we're hoping the recommendations will all be implemented. It was says that to make them a Jim say that if all these recommendations are implemented, lives will be saved. You know, no question about it.
Or consultation does not necessarily signify participation.
Participation must be active, free and meaningful. In practice, this should mean the voices of mental health service users are sought out.
Using human rights, a human rights-based approach to do something, and I think that's really what human rights is about. It's about people.
Formal channels for participation, are they adequate or not? An answer on this could be that because the channels are inadequate, people feel that they have no place to participate and they don't get involved. So one question is to review how is participation enshrined in formal mechanisms in order to have the voices of users and families in the process of decision making and evaluation.
The phrase used earlier of a journey towards rights, I think that's a journey that we're very much just starting out on.
With respect to poverty, for example, we have indicators that are showing wonderful progress while poverty is increasing because they're not measuring the right things. It's why it's so important that communities are the ones who themselves define what the indicators are to make sure that the indicators truly serve as a metric for human well-being. And then to be able to carry forth the lessons that are learned here to other struggles in other parts of the world.
Essentially, we have been talking about basic human rights. We're not asking for anything very exceptional here today. And I think that's been underlined over and over by the panel, that these kind of hopes that you have for the next 12 months are absolutely achievable and they're quite just and reasonable. But we just need to set those rights in action. Thank you.
The work of the group has shown their commitment and dedication to making mental health services better for their communities. The next step in the journey involves requesting the Health Minister to match this commitment by providing support to address the issues they have highlighted, and in doing so to make their rights real.